is 1 Million Cups? We are an organization by the Kaufman Foundation to foster a community of entrepreneurs to support one another. So we're here to support the presenter, give them good feedback. We also want to thank our sponsors, Idealworks, for giving us the facility here, and also Avoca Coffee, which we have a lot of that out front, so grab you a cup of coffee. And just some ground rules. Please raise your hand if you need to ask a question. So I'll help and guide the questioning, so when I point to you, you can ask. Just raise your hand, give respect to everybody. Limit your questioning to just one so that we can allow everybody to give their questions, their inputs. And let's have fun and provide constructive feedback to our presenter, Darren
Darren Tran.
Tran with Kool Benefits. So everybody can give a round of applause.
Thank you. How you guys doing this morning? Good. Hey, in the past couple of years, we've been actually deal with Affordable Health Care Act, and a lot of us hear different story, different thing about it, and a lot of people out there is not very happy with their health care at all. If you're not happy with your health care, you're not alone. So telehealth is the future of healthcare. So what we're saying is, if you have access to insurance, can you get access to care? That's actually that's what I'm trying to do the demonstration on. Okay. The deductible is high. According to Time Magazine, many states offer half the plan, and with healthcare.gov, the deductible is $3,000 or more per family. According to the New York Times, many deductibles make health law insurance is useless. Like I say, you can get a health care, but you can't get access to care itself. The increase of medical costs is by 81%, and employer plan to increase out-of-pocket costs by 2015 to 2017. The wait time to see a doctor, to make an appointment to see a doctor, Dallas, Texas is actually the fastest. It's about 5 days waiting time. 20 days for specialists. Now, Massachusetts, that's where the model of Affordable Health Care Act begin. The waiting day is 66 days for a primary care. So you're lucky you live in Dallas, Texas. So now, if you comparison to our plan, telehealth plan, the ER visit is $1,477 for the average. Our plan costs you $0. Same thing with urgent care. It's $163 average. Our plan is $0. A specialist is about $200. Our plan is also $0. And a primary care on average is $131 today. Our plan is $0. Now, you add in the cost of traveling and the cost of you going to the doctor and the time that you wasted, you probably on average saving about almost $600. Telehealth is on the rise. The reason why an employer want to look at offering telehealth is to reduce medical costs, improve access to care, make employee happy, improve employee productivity, and attract new talent. And everyone here, when we go and look for a new job, the thing we often ask is, how's your health care plan? So one of the things that we notice here, most telehealth have only a short time because the technology is fairly new and people begin to adapt it. When I spoke to a lot of individuals out there, or company out there, the question that I get is this for real? I say, yes, it is. And then it's legal. I say, yes, it is. One third of employees offer telehealth today. We expect on the rise. 49% added telehealth to 2016. Okay, and 45% is unsure right now. Who we are? Denise Dong, she's actually the CEO, and she's here. And I myself, I run the Senior VP Business Development. And what do we do? There's 5 components to our business model. There's 4 basic, but I throw the 5th one in because this is a demanding field. The first one is telemedicine, telehealth, telemedicine. The second one we have in our components called a health advocate. The third component is the counseling services. And the fourth is doctor online. And the fifth is the pharmacy saving program. Now, how's telehealth work? You can talk to a doctor anytime. And who is our doctor? Our doctor is U.S. board certified in that state. And you can access the doctors 24/7, 365 a day. We can even prescribe you medication over the phone, app, or via computer. Now, how satisfied is our subscriber? Patient resolve 92% of the time. Average callback time is 16 minutes. Or you can schedule a lunchtime or a perfect time that actually convenience to you. Now, satisfaction is 95%. Try to get that at your primary care or any other doctor. How do we proceed using our telehealth services? Complete the medical history. Second, request a consult. 3, talk to a doctor. 4, resolve our issue. And we prescribe medication if needed. Now, when can we use telehealth? When it's convenient to us. When the doctor have no appointment, after hours. Schedule doesn't permit traveling. Let's say you travel out of the state for work, vacation, okay? Business trip. You need a refill in your prescription and short-term prescription. Geographically, meaning that you are in the rural area or your office not near anywhere by the doctor office. We can actually take care of it at any age, pediatric all the way to, there's no age limit. What can we diagnose it? We can actually diagnose most non-emergency issue. Here's some of the sinus problem, UTI, pink eye, bronchitis, respiratory infection, nasal, allergy, cough, ear infection, and more. How do we prescribe a medication? Just like if you were to go to your primary care. Best practice prescription management. We go by the CDC guideline. We do not subscribe controlled substance. And 98% of we do promote generic. So it's very affordable. Okay? And we use e-subscribing. Now, where can we use the telehealth services? It's in 50 states. We have the capacity to support 100 million users each day. Huh? The only state that we cannot actually, there's no visit, is actually in Arkansas. Okay? You look around, most states, you can do video, phone visit, and prescription. Texas being the only state that you can use phone visit only, it actually, because non-emergency, it doesn't really make no difference. 10 years ago, we actually call up a doctor at night, say, hey, my child got sick, or I got sick, can you prescribe a medication for me? Recommend over the counter, or send prescription to the pharmacy. All right? The second part of our component is health advocacy. What's health advocacy do? We help you navigate to the healthcare system. We actually, who are our advocacy? We are claim expert, nurse, and we are case manager. And we help you navigate to the complex of healthcare. We help you find a specialist. We help you find or schedule an appointment. We help you lower your medical bill. The second part we have on our component is called Doctors Online. So normally, where do we go to find our information? Do we go and search on Google or WebMD? Because the answer is specifically not designed for you. With Doctors Online, actually a specialist will answer your question. I'll give you an example. If you have a little rash on your hand, you can actually take the pictures and upload it, and there's a specialist within 2 to 3 hours reply specifically designed for your answer. Okay? The third component that we have is telephonic counseling services. We are available 24/7, master degree counseling level. Okay, no copay, no fee to member. Any of our service would not add any additional cost. You just pay one monthly fee. Okay, immediate crisis support. Okay, we have a 100% follow-up counseling service. Being a counselor, that means if that counselor handles your case, that follow-up counselor will follow up with you. You will not be talking to a different counselor every time. Okay? And we do refer you to a behavioral hospital if needed. The third is the prescription. Prescription saving. Prescriptions are on the rise, and not only that, there's certain medication that certain patients needed that insurance no longer cover. It will be out of pocket cost. So basically, our prescription plan will give you a significant amount of saving. I will run that through at the end of the show you what kind of saving we're talking about. Okay. How's our price work? Our basic level start out with telehealth, health advocates, doctors online, and health well connection, and prescription saving is $12 cover the whole family per month. So doesn't matter if you have 10 kids, if you decide to adopt 10, it's all covered. The second plan is the one that included, the only difference between our telehealth plus is included the counseling services. The telehealth complete, it includes all the first two, telehealth and telehealth plus. Additionally, it included the dental and the vision plan. The only difference between your current dental plan and my dental plan is you don't have that $1,000 credit that you're paying $80 a month. At the end of the year, you actually paying it for yourself. That's included. It is powered by Aetna Dental Access PPO. So whatever the PPO agreement that make with the dental, that's the pricing you're getting. Okay. Now we also have medical travel assistant and legal care direct. If you heard of Legal Shield, that's actually part of it. Okay. All members will get a booklet and an insurance card. We don't call ourselves insurance because we do not meet the guideline of Affordable Health Care Act. Of course, you can get in touch with us. Our location, we located in Grand Prairie, Texas. Our phone number and our website is actually recited on our logo, koolbenefits.com.
So see you around there. All right, so this will start our Q&A phase for the 1 Million Cups presentation. I'd like to start off with the first question. What is it that us, the 1 Million Cups community, can do for you?
What do you
Or
want
we'll help you.
That's our last question.
Help, yeah.
Again,
What do you hope to get out of it?
What are you helping?
our program, like I mentioned in the beginning, a lot of our clients or employer found our products unbelievable. So what I've been having a lot of encounter is, I have to do a lot of education. I have to educate the public about our product, to let them know, hey, our product is here. It is the new tool to access to healthcare. Now, because our price is so low, is also make it unbelievable. That's why we put in a 30-day guarantee. So you don't like the product in any way, we can actually say, here, you give us a try, you didn't like it, here's what you pay. And
So that was in mind, just raise your hand, one question at a time.
You mentioned it doesn't qualify as insurance. Does that mean this would be in addition to an insurance plan?
yes, basically what we use this as a bridge, a gap, we call it, to insurance. Let's say, for example, you have high deductible on your insurance. I say an average $3,000 low. I've seen as high as $5,000 to $10,000 deductible. Not only that, we talk about co-insurance. What's co-insurance is, let's say, for example, you decide to go to a doctor. Now, an average estimate time is 121 minutes for you to get from your house to access to a doctor, waiting room, and so forth. That come out to, let's say, if you were to make $21 an hour, that come out to about $45 of lost time. Now, we're talking about you go in the doctor office. If you have plan, most people just have plan that actually, if they haven't met the deductible or have co-insurance, they have to pay the $131 up front. Now, with my program, you actually, not talking about the time saving, you actually save money by one-time use, just one time. It would actually pay for itself the whole year. We haven't talked about convenience. Yes, sir.
Okay, with Obama crap. So you're trying to eliminate the small little ERs, the small little care nows, and just trying to eliminate that experience altogether. Are you trying to do yes?
Yes.
Do you have to go see a doctor and get a trusted relationship with a doctor prior to using your services?
No.
How do you get around that?
Okay. Basically what it is, the doctor that's in California have to be the one that's servicing you. It cannot be the doctor in Texas. To make it legal, that doctor have to reside in that state. That's how you get around it. Now there's a battle going on between a telehealth company versus the Texas Board of Medical Board. They actually, because with their best interest, okay. Basically what they did was they're trying to stop telehealth. That's the reason why telehealth in Texas, we only have phone conversation. They try to stop it and overall, because what it is their interest is lost, meaning because basically what happened was when reimbursement got cut, doctor had to be creative. I don't know I use the word creative, is actually because the true translation is they in a lot of what we call pod, investment model, okay? So everything you walk into a doctor's office, basically they would try to say, hey, let's test this on you, let's test that on you, is their best interest. So when telehealth is on the rise, they actually got panicked. And you ever seen the Texas Medical Board? There's only one doctor sat on the board. The rest of them is business.
Darren, I don't want to make it, very clear that telehealth, like what Donnie said, is a supplemental. It doesn't replace your
No,
healthcare.
it is
Because Obamacare is mandatory that every American citizen or green card
Yeah,
holder
we-
had to have, insurance.
Right.
So I actually have telehealth with my medical plan. It's called virtual health. And our plan with PCC is actually through United Health. And I'm effective like a month ago. So like you said, it's brand new. And what really cool about virtual health is allow me to install an app and talk with either a doctor on demand or the other start with an A, I forgot. So I have two providers that I can talk to. So are you very similar to that? Are you exactly
Yes.
the same like that?
Yes,
But for people who probably like self-employed, or people who don't have like good insurance like I have.
Yes. Yes, sir.
How do you get around the HIPAA
How,
laws?
we actually certify HIPAA.
Well, especially when you're in the states that you're doing video chats and everything else, all of that material is not out in the universe. What happens if you're hacked?
That's the reason why we use an encrypted protocol. There's ISO 27001. We are HIPAA compliant, and actually, when you actually enable our app or go online for communication, we actually is HIPAA compliant, and we are certified HIPAA compliant. Because the protocol is secure going across, because there's an encrypted protocol. Let's say you turn on our app, and actually your phone, the app within your phone is encrypted. The communication is
Because
complete.
my struggle is, so I have a rash on my arm, I take a picture of the rash, it's sent to who?
It was sent to a specialist that actually, kind of like, it was sent to a group of specialists, okay? Because you have to use an app to actually upload it. And when you use an app, it's actually secure. Kind of like your email, depending on what email you use, there's an email that's we call a secure protocol, zip code, or any other email out there. Same thing, if you send an attachment, you use it, you attach it, we encrypt that message.
Rob?
I'm confused. Why can't you do video calls in Texas? Because last summer I did one with Teledog. I was on vacation in Port Aransas and something bit my leg and my whole leg swelled up. I did a video call with the doctor. He gave me a prescription, and 2 days later it was fine.
Yeah. See, so you say you did it in Texas?
Yeah. It was
Okay.
right by.
Well, actually,
Or South Park. It was in
Okay.
South Park.
I don't know how you did it, but in Texas, actually, it's not legal to do video. Actually, I actually talked to Connie Burton and Bill Zettler. We actually working with state representative because there's a need for telehealth. And actually, continuing with the story, Texas Board of Medical actually is trying to stop telehealth. And what happened was the states of Texas step in and say, no, you can't do that, because we need to access to care in a rural area. And I spoke to one of the COO at the hospital, one of the hospital and CEO. Hospital in the rural area is closing faster rate than we can imagine. They're going bankrupt. There's no support for in the rural area. Now, if we can't get access to care, now let's take to another notch. Let's talk about senior disability senior. I don't know. I deal with a lot of disability senior because I used to also own a DME company. Now to have them go out and basically say, for example, to go see a doctor. Now you have to schedule a handy tran, and they're in a low income bracket. Now they have to sit there in the waiting room 2-3 hours now to get them back. We look at costs. Yes, ma'am.
So it's kind of like a two-part question. So the first one would be, how does your app or your network connect with people who use more self-diagnostic measures? So these are the people, for example, that will get their blood drawn and then they'll send it off to an independent lab. So do the doctors that, like, let's just say I sign up for the app and I'm connected with a particular doctor, does that doctor now have access to go ahead and, you know, get my lab information that I sent off to X, Y, and Z?
Well, what we're trying to do is to take care of what we call non-emergency. Doesn't require a lot of interaction. So basically, we can do that, but what you have to do is you have to do all the lab and everything else before our consultation, and you upload to our medical history. And actually, after I diagnostic, you can actually download a diagnostic or synchronize with your primary care system. So basically what it is saying, hey, I talked to a previous doctors, you know, telehealth doctors, and basically this is what he diagnosed me with, and this is what the prescription he prescribed. We can actually synchronize with your primary care system. Not only that, let's say, for example, you want to get off work, and we diagnosed that you, let's say you have bronchitis or anything like that, say you need to stay home, you can actually download a doctor note.
You can download
A doctor note, yeah.
Okay, so what is your diagnosis protocol? So either way it goes, I would still have to go into, you know, a primary care doctor's office or whatnot, and then give you that information. Or do you guys like deploy phlebotomists? Because I know like that's a...
No, we don't deploy any phlebotomists at all. We actually take care of non-emergency. Let's say for example, you know, hey, bronchitis, flu, allergy. We don't deal with a lot of requirement that require lab. If you upload your medical history or your record that we can use, that's actually good. So
I totally understand that you are a supplement. You know, you're not the insurance itself.
Mm-hmm.
So for all of you, I think that you have to realize this is like for really my symptom that doesn't need you to come into to see a doctor. You can diagnose over the phone.
Mm-hmm.
But probably 80% of most doctor visits is like my problem because really small problem you can just talk on the phone. I have 2 young children like ear infection, bronchitis, coughing, a rash. Those stuff you don't need to take up work to go to a real doctor. You can just talk with or do a video conference and you can take care of it. So that's really help with the gap that Darren was talking about. But my question is, so do you still encourage the subscriber to still have insurance, on the side?
We do
Because,
not.
Like if you break a leg, no telehealth doctor can help you with that.
Yeah, basically we even stated everywhere, even on our business card, say this is not your insurance. We do not tend to mislead anyone. We want to make sure to let everyone know we use this for non-emergency purpose only. 70% of the patient that submit themselves to ER is actually non-emergency, can be taken care of. Now you imagine the money we can save from emergency care visit.
So how do you or your system control like abuse of prescription?
We don't subscribe controlled substance, and that we do subscribe antibiotic. We diagnose you exactly how you were with your primary care. Not all primary care will also write you antibiotic. Okay, there is a history profile on who called. Let's say, for example, you pretend you call for your cousin. Okay, say, hey, I got a cold and everything else. Yes, you put him in the phone. The doctor not gonna know. If we look at your medical history on there, we subscribe more than certain antibiotic per month. We're probably gonna say, hey, there's a red flag.
So even in this room, you've got a huge gap between people who are very familiar with what you guys do and people like me that think it's a really cool thing but have never used a program like this.
Mm-hmm.
You talked a little bit, your struggle is the educational side of things. What are you guys currently doing to increase awareness about your product, service, and educating guys like me that have never used the phone to do something like that, ever, but would like to do it all day long?
Mm-hmm.
I mean, I don't go to the doctor for anything but my wife. So how are you educating guys like me? How are you reaching out to the audiences that
Well, there's a couple of things that we currently do right now. We go out there and educate. We do health fair. That's one thing. Second thing, what we do is we actually partner with the city of Mansfield. We will be doing a health channel, and in the Vietnamese community, we actually will be invited into the health channel describing our product. Community outreach, we already been doing that for a whole year. We actually going out there and say, hey, a lot of them found our product, then again, unbelievable, because our price. Not only that, because the service. When you and what I did is also hire minority, like Hispanic speaking, going out there, explain to other group out there to say, hey, this is the product and this will work. Because the more I educate the public out there, the more they stop going to the ER. And actually, if someone go to ER, our tax dollar is at work.
So who's your specific target customer base?
Specifically, we trying to do is, because our price is low, we trying to aim at employer. We trying to promote this in an employer. We do by quantity and provide quality, right? What we want is employer, if employer to pay, let's say our plan start at $12, employer with 10 or more, they only getting the price for $10. So we submit a bid actually in for the Mansfield ISD district, and actually they're looking at our bid right now. And I'll give you an example about they're having a huge issue on, if you do research online, they have a huge issue on teacher using PTO time. And you know how inconvenient it is once a teacher decides to use a lot of PTO time. Then you have to pay for substitute. Not only that, the student in that classroom got lost, or basically just sit there and do nothing.
Is there any sort of open enrollment? I'm sorry. Any sort of open enrollment?
No, you can actually, there's no contract with our product. You can actually jump on board anytime. You can actually cancel anytime.
So what's the 30-day money back?
30-day money back guarantee, let's say from the day you sign up to next month. If within 30 days you're not satisfied, we can actually say, hey, you can have your money back, we refund it. Now, the only difference between the individual and a group with 10 or more, we do not charge them for the application fee because our price is so low. Individual, we charge $9. We have to print the booklet that you've seen in the insurance card, we call it. Okay?
Rob.
I forgot what I was gonna ask.
So how is the dental play a part in a virtual network?
Well, basically at the end of the day, basically I'm going back to the Affordable Health Care Act, okay? Now, have you ever seen the Affordable Health Care Act dental program? There's a waiting period for everything. Now, I mean, when you want to do something on your dental work, were you willing to wait 6 months? There is a waiting period. So what we did was we packaged it into dental and vision. We give them what we call a discount program. We added a discount program into it. So basically we partner with a group out there that actually have the ability to give us the pricing for Aetna PPO access. So
essentially, basically what someone would do is they come in with their card, they say, okay, I need to get in the chair today, or get in the chair 2 weeks from now, and normally the price would be $70, but with this card, the price is $35.
yes.
What is waiting time? So let's say that I have ear infection, I either video conference or call that that benefits. Was it like half an hour to 2 hours, like my experience with other, like customer service, or was it like within 5-10 minutes? Like, is there like expected wait time?
Actually, our wait time is average of 16 minutes, or you can schedule do your lunchtime.
Oh, okay. Oh, 16 minutes. I remember you
Yeah.
told that. And what's the average like appointment time? Like Like when I get on the phone and talk with doctor, usually.
There's no limit.
No
You can
limit.
actually talk as long as you want. We're not going to rush you trying to get that at your primary care. They want you. I don't really ever go to an urgent care or any of those. Actually, if you go in the back, because I used to set up total turnkey for a lot of urgent care. One of the things we have to set up is a system to track how fast a doctor is seeing you. and you actually go back, there's a huge screen in the back. It will alert the doctor, you're taking too long, you're taking too much time on this patient.
Oh, wow.
So you fixed the time in the waiting room.
Uh-huh.
What about when you get damn prescription?
Actually, same thing. You can actually, within an hour, you can drive to let's say, for example, you travel to Colorado for a skiing trip. Your kid got sick, your vacation got ruined. You can actually say, hey, I got a pharmacy right here next to my hotel. Can you send a prescription right there next to that my hotel?
I can send you good stuff in Colorado too.
Yeah. Yep.
So I know that in the old way, you take the prescription, like the piece of paper, the doctor, and go to the CVS, but nowadays they can just like send it electronically to that exactly, pharmacy that you want, right? So
Yep.
that exactly the whole way. Right?
Yep.
So from state to state, is there different regulations?
There is. The only
Interesting follow-up, Sean.
yeah, the only different state that you see on our map is actually Texas, Arkansas. Actually, that's the only actually state that actually you see in a different color. In Alaska, we have shortage of doctor. Actually, if you search on it, 70% use telehealth.
Oh, okay, I remember my question. So, it sounds like here locally you've got, the ball's rolling and things are going, especially in Mansfield. And I saw the team looks like just you two,
Mm-hmm.
50 states. How do you plan?
Well,
to
what we
tackle
do is we partner with the largest healthcare providers out there. We build infrastructure. Everything we actually partner with them. Even call center. We even have customer service actually in Dallas, Texas. Let's say, for example, you have a question regarding your member. You actually can call us from Monday to Friday, 7 a.m. to 7 p.m. And then Saturday, 8 to 5. And someone will actually answer the phone for us. The way we build our infrastructure is, it requires, if you would have every component, that actually individual component, the cost will be pretty high. I would have to send my company to a public trading company just to be able to afford everything. What we did was, throughout the year, building infrastructure for doctors and urgent care. What I did was I go out there and actually contracted out a certain component of everything. And I looked for actually component out there that who we can make deal with that actually can service part of our product.
While working in St. Louis, I worked for a pharmacy company up there. It was a franchise set up. One of our pharmacists got actually busted by the federal agents because he kept making fictitious people that he was writing prescriptions for.
Yes.
How do you prevent people from going in and making these fictitious medical records, this, that, and the other, to
Well,
acquire drugs?
like I say, everything we diagnostic in our system, it will be stay in the system itself. So when the doctor go over your diagnostic, they actually have
It's
to.
not necessarily the doctor, it's somebody coming up and making, me being 17 different people.
Mhm.
So now I'm Bill, Sam, Bob, George, this, that, and the other, and you're constantly making different profiles, paying the nominal $12 a month, or even worse, create my own group and getting a bigger discount, right? Just so I can get a bunch of scripts. How are you preventing?
Let me give you the difference between the two. Our script is non-controlled substance. It doesn't work anything.
If I'm a chemist, I can take almost anything and move it.
You can't get like hydrocodone
No.
or all those
No,
opiates.
no.
or anything like that.
Now there's
Stuff everybody really.
yeah, our product is actually what you normally would get everything out of primary care because primary care will not even subscribe you
They
to
use
payment.
CPAC?
Yeah, they do.
Do a lot with CPAC.
What is y'all's background?
What is my background? I've been in the medical field for over 15 years. We operate anywhere from a DME company to adult daycare. I've been setting up a total turnkey for urgent care, medical field, and Denise here, she's actually 26 hours away from master's degree in healthcare management, and we've been running multiple medical offices.
So did you build this from scratch?
We build this product from scratch. We partner and
Is there other competitors like you guys out there? Are you
There
kind
is.
of like the first guy on the block?
no, there's other competition. I'm not the only smart one out there.
So Darren, I know that this is a new concept. It's only available in major corporations like a couple months ago. So the work is out there, but there's actually a lot of awareness and trust yet. So my recommendation is that you do it in the right thing. You do the health fair, you do this, that. But can you make like a video that describe the process?
Yeah, we do.
A picture speak 1,000 words, but the video probably speak 1,000,000 words that describe like, you sick, you're away, call the phone, doing video conference, and your 90% of your problem probably gets solved with you in one phone
We
call.
actually have all kind of video on our website.
Or on your website.
Uh-huh.
But my question is.
We have video channel, Kool Benefit too.
Oh, okay.
And we actually do like I mentioned, we do a health channel with the city of Mansfield, and Mansfield is actually a hospital hub now. There's a lot of hospital district. There's a lot of doctors in that area. We actually now seeking out a couple of doctors. Actually, one of the doctors that we be interviewing with is supporting our program because there's no better person to support our program than doctors itself. If you don't get their testimonial, say, hey, I believe in this product. I'm just a regular average patient. If it's coming out from the profession itself, people tend to believe more and actually believe in the product.
So what is your vision, for the company, 1, 3, 5 years down the line? I know right now it's a two-person shop, but what's the plan?
Well, you run the report for me.
I did.
You run a report for me. Our industry is expected to be almost 40% growth every year. There's a lot of obstacle right now. The biggest time that we spend in money is education. What we do is continue to educate about our product. We do a lot of explaining. We tend not to try to concentrate on the individual because our pricing is very low. If we concentrate on the individual, if you're making $12, that's not business sense. So we tend to go to more corporation, and we do a lot of event, or we network with a lot of human resources, personnel. That's how actually we trying to get our words out there. And like he said, he used Teladoc before, and then what the different our pricing with the current regular pricing is actually our partner is Teladoc actually.
It cost me a fortune.
Yeah, it costs you $40 per car, is it?
Well, that was down there. It
Oh.
charged me it was like 160.
Yeah. So basically, it costs you a minimum of $40 because you have some kind of plan of insurance. Then additional to that, you cost $40. Our plan, you can call 10 times a month. You can call 10 times a week. You can call anytime you want. There's no additional cost. So getting that's why a lot of people out there, our pricing sounds very unbelievable, but it doesn't work.
Where are you trying to grow your business?
If we can go nationwide, that's the ideal because our product we can actually offer in 48 states. The only 2 states that we can't sell the product, even though you can use them, is Washington and Vermont. We can't sell the product there, but we can use. You can use them. It's interesting.
So how far of a reach have y'all gotten so far?
Right now, we're talking to a couple people in California. California, actually, if you do a search on it, they're actually pushing it. The state is pushing it, being part of the insurance plan, because it will save them significantly amount of money. The reason why a lot of us go into urgent care is, say, for example, we work late hours. Now, being an entrepreneur, we actually don't have time. Then actually we always put it aside. When the worst comes, is always needed at night or in the weekend, and that's where when we decide to go to take ourselves to the ER. At the end of the day, it costs us more money. So that's what.
So do you plan on in the future tackling some of those, I guess, more of the regulatory side and finding whether it's lobbyists or
Well,
people to speak on behalf of telehealth and
the advantage that I have been in this past 2 years, we have built a relationship to a lot of state senators and representatives. That's one of the things that we actually did at the beginning, because I know telehealth is out there, and what we've been doing, telehealth been around for 12 years, more than 12 years, and actually we've been reading about it, and I've been studying telehealth for almost over 4 years, and I seen the obstacle, and I seen it. So what we did was we got very involved politically on both sides. We do not affiliate with just one party. When you deal with healthcare, you don't want to affiliate with one party. So basically, what a lot of our subject when we meet with the state senator or representative, that's what the thing that I push with. Who do I bring to the board? I would say, hey, I know a COO at some certain hospital. I know a CEO of a certain hospital. We actually have very close relationship with MCA, Medical Center Arlington, Methodist, and THR. And I am also part of the Tarrant County Health Initiative. So
I want to thank everybody for their inputs and for being here today. And let's give a round of applause to Darren.
thank you.
And Walt will close this out.
yeah. So the final question, which you are already familiar with, is what can we, the Fort Worth community, do for you and Kool Benefits?
Well, basically, the best thing you can do for me is you make my product real, because that's what we encounter. Like, it sounds unbelievable. Is it true? Here, is patient education. That's what we want to actually get the words out there and say, hey, telemedicine is on the rise, and it exists, and it will be the future of medicine.
So us at 1 Million Cups would love to present you the coveted
Thank you.
cup. So you
Now I'm official, right?
You're official now. Thank you once again.
Thank you.